Howdy everybody, it's Angelo, dailyvitamoves.com. One of the most valuable things that I think we can do for ourselves and our health is to learn about our bodies. Because when we get a little bit better understanding of what's happening in our bodies, especially with movement, we can have a clearer intention of what we're doing to get a more positive impact on the results that we want. So today I'm going to share a little bit of insight on an idea or concept that I use to help design some of these Vitamoves, these movements that I've been showing you, and that way you can think about this when you're doing these movements so you can get more out of them. I brought my book here. This is a Team A Atlas of Anatomy, and this has been one of my trustworthy companions in learning about our bodies. So I'm going to show you a picture of the ligaments of the hip, and hopefully you can take this idea that I'm about to show you to review some of the movements that I have shown, and I'll post links to some of them below, and you can think about this concept and use it while doing these movements. So come closer and I'll show you the ligaments of the hip. Alright, so here we have a picture of the bones of the hip. This is the right hip, the front view, and then this is the back view from behind. So you can see the hip joint is a ball and socket joint. You can see it more clearly here in the back, where the rim of the pelvic bone sort of wraps around this ball, the head of the femur. This is called the neck of the femur, and then this is your thigh bone here from the back. What's interesting though is the ligaments that wrap around the hip joint. Here's a front view, side view, and then again the back view of the right hip. So if you just kind of look at this area, you can see how the fibers of the ligaments appear to be wrapping around the hip joint. So from the side view you can see how it sort of fans out and then comes forward and then down into the neck, down the neck of the femur there. And then here, even in the back, you can see how the ligaments kind of wrap around this way. So the function of the ligaments is to help passively stabilize joints, and that way your muscles don't have to keep working to keep bones connected together. So this is just a efficient way to help keep the joint stable without you having to use a lot of muscle energy to keep the bones together. So here's a pretty cool depiction of what I was talking about. Here's on the far left somebody standing, so the thigh bone sort of continues down this way, and you can see the orientation of the fibers of the ligaments. They sort of wrap around here, and that's to help stabilize the joint. But when we flex the hip, so if we take a thigh bone and move it this way, you can see how the fibers of the ligaments sort of are more relaxed and open, and that's to help the ball, the head of the femur, to move within the acetabulum, the socket of the joint. On the right here is a simple model of depicting what's happening. So you can see this is the rim of the femur where the ligaments attach, and then this is where the ligaments attach onto the rim of that pelvis of the socket. And when we're standing, this is the orientation. But then when we lift our thigh bone to the back, so like this, if we were to bring that thigh bone back like this, you can see how the fibers will sort of wrap even tighter around the joint. So this will sort of compress the joint, the ball and the socket together. And then on this picture you can see when we flex the hip, the ligaments are a little bit more relaxed and open to allow the socket, the ball of the femur to move within the socket. So there's two really cool things that's happening that I'll mention here is the cycle of tensioning the ligaments and then relaxing them, and the same thing with muscles, is that cycle helps to maintain our ability to withstand the forces of all different kinds of movements that we do. So when we are more stagnant or sedentary, we will lose that ability. These ligaments will start to get more stiff, let's just say. They will lose their ability to adequately hold that tension or adequately open up to allow this hip joint to move. The other cool thing is that the cycle of compression and then decompression helps to stimulate fluid in the hip joint, and the joint surfaces are like sponges, the cartilage of the joint. Let's just say when we compress and decompress, it's sort of like squeezing a sponge and then releasing, and then it sucks up the synovial fluid. So these cycles of compression and decompression helps to keep our articular surfaces, the cartilage of our joints, healthy. Awesome, so now that you have a little better picture of what the hip joint looks like and what could be happening when you move the joint, go ahead and try some of the movements below and just imagine what's happening when you lift or flex the hip and what's happening when you lift back this way. Just think of those ligaments sort of tensioning and relaxing. Think of the hip joint being compressed and decompressed and the fluid that's being stimulated as you do that. Have fun with that, and we'll see you next week.